An artificial pancreas could help better control diabetes, but it's still just an idea. Artificial pancreases have long been a dream of researchers and people with diabetes. Although it is still far from perfect, recent technological progress is gradually making that dream a reality. Is it possible to put the artificial pancreas into practice in the future? The answer will be in the following video. How does the pancreas work? Complications of diabetes. The pancreas produces a very important hormone called insulin. After eating, the pancreas secretes insulin into your bloodstream. Insulin helps the body turn sugar, glucose, into energy. Insulin also protects the liver and muscles and helps fat cells take in excess sugar to store it until you need it. Without insulin, sugar builds up in the blood leading to hyperglycemia. Without treatment, high blood sugar can lead to a diabetic coma, diabetic acidosis, and be life-threatening. Long-term complications of hyperglycemia include heart disease, nerve damage, and kidney damage. In addition, when blood sugar drops too low, hypoglycemia, you may have vision problems, feel shaky, and have altered consciousness. Worse, you may pass out, have a seizure, or go into a coma. In short, the job of the pancreas is to release insulin at the right time and in the right dose to stabilize blood sugar and prevent these complications from occurring. Why are we interested in artificial pancreas? People with diabetes, especially type 1 diabetes, have a pancreas that cannot produce insulin. From there, the sugar will not be separated from the blood, leading to abnormal blood sugar levels. That's why people with type 1 diabetes will need insulin injections. At the same time, it is necessary to regularly monitor blood sugar, calculate how much insulin to use and when to use it during treatment. Sometimes insulin injections 2 to 4 times a day can be painful. Over time, the injection site can cause an accumulation of fat under the skin known as adipose tissue proliferation. This condition makes it harder for the body to use insulin. Many people with type 1 diabetes choose to use an insulin pump instead of injecting multiple times a day. The pump secretes insulin throughout the day. With the pump, insulin is delivered through a catheter placed under the skin of the abdomen. Patients can also press a button to increase the insulin pump after eating. However, people using insulin pumps can face many inconveniences, especially having to turn off this type of machine when taking a shower, and may run into unwanted risks. Furthermore, injecting or using an insulin pump under stress for various reasons can make a person feel fatigued. Therefore, experts are increasingly interested in artificial pancreas. This can be a great alternative and makes it easier and more convenient for people to control their blood sugar. In addition, this support can also reduce the stress associated with insulin treatment to improve the quality of life of people with diabetes. How does the artificial pancreas work? The artificial pancreas will not be the same as the natural pancreas. It is not an internal organ. Instead, it is an organ outside the body responsible for constant blood glucose monitoring along with an insulin pump. Two components of the artificial pancreas were used. First, the continuous glucose monitoring, CGM, system checks sugar levels through a sensor under the skin. The CGM then sends the results to the monitor wirelessly. CGM users must check their monitors to see if their blood sugar levels are too high or too low. They can also set the machine to alarm when blood sugar levels go out of a safe range, or you can also set the machine to record data about blood sugar changes. Second, body-worn insulin pumps can inject insulin into the body throughout the day. The third component is the most important element of the artificial pancreas. This is the technology that allows the CGM and insulin pumps to communicate with each other. It sounds simple, but communicating properly is a rather complicated process. In an artificial pancreas system, a glucose monitor sends information to an external controller attached to an algorithm. Using an algorithm, the device calculates the required dose and directs the pump to deliver the appropriate dose of insulin. The transfer of information between the devices will do the job of regulating insulin like a healthy pancreas. Thanks to this system, errors in injection and dose calculation will be reduced, helping patients avoid many health problems. Clinical trials with the artificial pancreas are underway worldwide. However, there is still no such system that really works. The U.S. Food and Drug Administration has not approved any devices for use in the United States. The future will be like sports practice. Even if this approach worked, an artificial pancreas would not be a cure for diabetes. It cannot replace the role of self-monitoring of blood glucose or changes to a healthy diet and exercise in disease management. However, this system can significantly reduce the risk of hyperglycemia and hypoglycemia. It could change the way people treat and manage diabetes, as well as improve the lives of people living with diabetes.